Thank you, Chair Brownlee and Ranking Member Dunn, for the opportunity to speak today about the importance of improving VA services tailored to the needs of women veterans. I'd also like to thank the committee for their continued efforts this year to make VA more accessible and equitable for our women veterans, and for Chairwoman Brownlee for your leadership of the new Women's Veterans Task Force, which I'm proudly a member of. Women veterans are the fastest growing demographic in the veteran community. Women comprise nearly 10% of the veteran population, and that figure is expected to rise to 18% over the next 20 years. As a result, the number of women veterans seeking care at the VA will certainly increase, and VA needs to be ready. However, 75% of women veterans do not use VA health care and face a number of inequalities in a system that simply hasn't adjusted quickly enough to meet their specific needs. That is why I introduced H.R. 2972, which directs the VA Secretary to improve VA's communications regarding services available to women veterans. While VA has begun to offer text messaging as a way to connect the Women's Veterans Call Center, and I commend VA for doing so, my bill would statutorily require VA to include a text messaging capability at the Women's Veterans Call Center. The Women Veterans Call Center is staffed by female VA employees who can provide and link women veterans to information regarding resources available to them, and requiring text message capabilities at the call center will make it even more accessible. Additionally, this bill would make navigating VA websites easier by creating a central web page where women veterans can access various information regarding the extensive resources available to them within VA. This page would include the locations of each VA medical center and community-based outpatient center, as well as the name and contact information of each women's health coordinator and contact information for staff from the Veterans Benefits Administration and the National Cemetery Administration. This bill would build on efforts by the VA and this committee to ensure all women veterans are aware of the hard-earned resources and benefits available to them and where to turn if they are struggling. I believe this bill is a positive step forward towards making VA more accessible to women veterans, and I urge the committee to support this legislation. I want to thank Chairwoman Brownlee, and I yield back the balance of my time.